So you are here, it says, for a cranial nerve exam. Is that correct? Yeah, it is. Okay. And do you know what the cranial nerve is? Yeah, so it's a nerve that goes through your head and into your senses on your face. Okay. I'm just going to be checking that. Okay, I'm going to ask you to breathe in and out. Okay. Perfect. Okay. So I want you to inhale. Good. Just expand your chest. Good, good, good. Perfect. And exhale. Good. Okay, so I'm going to ask you to do that again. Perfect. So let me just check. Yep, that works. I'm just going to heat it up on my body so that it's not cold when it touches your chest. Okay, good. Inhale. Perfect. Hold it for a second. Good. And exhale. Good. I'm just listening for any noise, any sounds, any wheezing. Good. Okay. Great. Eyes look fine. Forehead looks fine. Cheeks look fine. Good, good. Jaw looks fine. Let me just see your neck. I mean, everything looks okay. Good. Can you frown? Can you frown? Good. With all your muscles, use it to frown. Good. Good. Pout your lips. Good. Can you move your eyebrows up and down, up and down? Can you open your mouth? Wide, wide. Good job. So again, that looks symmetrical. I would say you're fully opening your mouth correctly. Can you stick your tongue out? Good. All the way. Okay, so that looks like it goes all the way. So your tongue looks completely normal. The color looks completely normal. And your throat looks free of any infections. Good. Good. Perfect. Very good. Perfect. So just again, close your eyes. Good. Okay. Hard object. Okay, perfect. Hard object again. Good. Perfect. So just keep looking on this side right here. Perfect. And now again, just this side. I'm looking at this eye only. Okay. So this side. Perfect. And now look up here. So I'm going to hold up like 2 here. I just want you to say 2. Okay. So again, cover it. Perfect. Good. Good. 1. Good. 4. Good. 3. Good. 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 Okay. Okay, perfect. Okay, I'm gonna cover it so it doesn't go on the other eye, okay? So, okay, seems to be evenly dilating. Let me try from above. Alright, seems to be dilating. Perfect. That's our purse. Orange backpack. Green apple. So, stick up your tongue. Good. Chirp, 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 chirp. What would you say that was? Waft it towards you. Okay, tell me what that is. Yep, that is orange. That is orange peel. Hi, I'm Dr. ASMR. Welcome to the clinic. So this is the ASMR Neurology Clinic. I apologize for the wait. I hope you didn't have to wait that long. No, it wasn't a bad wait? Okay, great. So let's just get this straight. So can I have your name just to make sure? Okay. Can you spell that for me? Okay. Perfect. Can you make sure I wrote it down quickly here? Yeah, okay. That looks good. Alright. So I'm just gonna check my records. Sorry, just bear with me here. Just have to start up my computer. Okay. How is your day doing today? Good? Okay, that's great. So I'm just gonna write your name, and that's with an S, right? Perfect. Then last name. Just exit this. Perfect. Okay, so you are here, it says, for a cranial nerve exam, is that correct? Yeah, it is. Okay. And can I have your date of birth just to verify? Yep, that's exactly what I have here. And your location? Okay, so there's a different location on file. Do you recognize, do you have a previous address you used to be at? Okay, so just let the secretary in front know, okay? On your way out? Perfect. I'm not going to change that now, don't bother. Okay, so cranial nerve exam. Perfect. And what was the reason for your cranial nerve exam? Oh, you got into an accident with the car? Okay, yeah. Was it bad? No, just a fender bender? Yeah, no, I get so many of those every day. It's rare for one of them to lead to injuries, but just for insurance purposes, it's probably better to do a complete physical exam and a cranial nerve exam, just so that we can be sure, okay? Okay, does that sound good? Okay, so I will do a cranial nerve exam today, if it's okay with you. Perfect. Okay, so I just need your consent. Just right here where the X is. I just need you to sign. There you go. Perfect. Thank you. So the consent form is just kind of stating that you approve me to do your exam. I am a licensed neurologist in the state, and if you feel uncomfortable, thank you, at any situation or any point in time, feel free to voice any concerns that you might have, okay? And let me know. I'm just gonna sign as well. Okay. Today's date. Okay. 31st, okay. Okay, so this is your complimentary water. Okay, we give these out at our clinics, and you can just drink your water at any point, okay? Just to make sure you're hydrated. It's yours. Okay, there you go. So I'm going to start off by getting a patient history. Can you tell me if you have any medical conditions I should know about? Okay, and what do you use to treat that? Do you just moisturize your skin? Okay, yeah. No, it's very common, especially, you know, we live in a very cold climate where it gets kind of cold during the winters because we have all 4 seasons here. I would say it's less common in places that are more humid, but it's very common here. There's nothing to be concerned about, okay? So many of my patients have that. And are you on any corticosteroid creams for it or no? No? Okay. Let me just write that down. Perfect. And what do you use to moisturize that? Okay. I'll write that down. So, some petroleum jelly Vaseline. Perfect. Yeah, that works too. That's great. I know people have had success with that. Honestly, any thicker moisturizer would do well. Yeah. Perfect. Okay, so let's start the cranial nerve exam. Okay, let me just get my gloves. And do you know what the cranial nerve is? Yeah, so it's a nerve that goes through your head and into your senses on your face. Okay, I'm just gonna be checking that today. I'm going to be going through my checklist just to make sure everything's okay. Again, if you feel uncomfortable at any moment in time, let me know. Okay, perfect. So, we're going to start off with the basics. We're going to start off with the vitals, okay? So, first I'm going to check your pulse. I need your arm. Thank you. Okay, I'm just going to count your pulse. I'm going to time it, okay? Okay, 1, 2, 3, 4, 5, 6, 7, 8, 11, 12, 13, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30, 32, 33, 34, 36, 37, 38, 39, 40, 42, 43, 44, 45, 46, 47, 58, 59. Okay, perfect. So that seems like a normal pulse. It was 64 beats per second. Sorry, per minute. So that is completely normal. Now I'm going to check your breathing. Do you consent to me touching you for breathing? Okay. So I'm just going to take my hands, okay, and I'm just going to put them on the bottom of your chest. And I just want you to breathe and listen to my instructions, okay? I'm going to ask you to breathe in and out, okay? Perfect. Okay, so I want you to inhale. Good, just expand your chest. Good, 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 perfect. And exhale. Good. Okay, so I'm going to ask you to do that again. Okay, so inhale. Fill your entire chest up. Good. Hold for a second. Perfect. And then you're going to exhale. Good. Good. And I just want you to do that a few more times. Okay, so inhale. Perfect. Okay, so I'm just checking that your ribs expand properly. Good job. And I'm checking for evenness, that your chest expands evenly in all directions. And I'm also checking that there's no sounds or any unnecessary vibrations that we might not want, or that could be indicators of other problems, respiratory problems. So I'm just checking for that, and I don't feel anything. Breathing seems completely normal. Okay, good. You can stop. I'm just going to put on the stethoscope, okay? So I'm just going to check your breathing again. Oh, sorry about that. Okay, perfect. So let me just check. Yep, that works. I'm just going to heat it up on my body so that it's not cold when it touches your chest. Okay, perfect. So I'm just going to get up and come closer to you. Perfect. So I'm just going to check your breathing. Okay, perfect. Good. So just breathe in. Good. And breathe out. Very good. Okay. So again, I'm just listening to the breathing again. I'm listening much more deeply than before because now I have my stethoscope. Good. Inhale. Perfect. Hold it for a second. Good. And exhale. Good. I'm just listening for any noise, any sounds, any wheezing. Good. I'm just going to do it on the other side. I'm just going to heat it up again so it's not cold for you. Good. Okay. I'm just going to put it on you. Perfect. Okay. And just inhale. Perfect. And exhale. Good. Inhale. Good. And exhale. Perfect. Okay, one more time. Inhale. Good. And exhale. Perfect. Okay, your breathing sounds normal, I think. I'm just going to check on your back. I'm just going to go behind you if that's okay. Okay, perfect. So I'm just going to go all the way here behind you. And I want you to do it again, okay? I'm just going to check the same thing from your back, okay? So, inhale. Perfect. And exhale. Good. Inhale. Good. And exhale. Perfect. Okay. So, breathing seems totally okay and very normal. But if you hear any strange noises, any strange sounds, it was deep, it was even, so breathing is completely fine, okay? Okay. That is good. I didn't hear any mucus or anything like that, so I'm just going to say that's normal as well. Okay, now I'm going to check your blood oxygen level. Okay, so I'm going to take this little clip. Okay, give me your finger. Perfect. I'm just going to put it on your finger. Good. I'm just going to hold it there. Okay, so it takes about a minute for it to measure your blood oxygen level. Okay, and I'm just going to leave it there while I do the other tests. Okay, so I'm going to start off with the cranial nerve for your face. Okay, so have you noticed any difficulty making facial expressions in the past month or since your accident? No? Okay. Have you noticed any facial weakness? No? Okay. Perfect. So I'm just gonna look at your face. I'm just examining your face. Good. Good. I'm just looking for any symmetry. Okay, good. It looks symmetrical. I'm looking for if there's anything that's not moving really at the same amount on one side versus the other. I'm looking for some droopiness. I don't see anything really unusual. Okay, great. Eyes look fine. Forehead looks fine. Cheeks look fine. Good, good. Jaw looks fine. Let me just see your neck. I mean, everything looks okay. Good. Okay, so I'm just going to ask you to make some facial expressions to make sure that your face moves evenly. Okay, so can I see you smile? Good, big, big smile. Open your teeth. Good, show me your teeth. Good job. Good. Perfect. Now, can you frown? Can you frown? Good. With all your muscles, use it to frown. Good. Good. Pout your lips. Good. Can you move your eyebrows up and down, up and down? Good. So eyebrows are moving evenly. Do it again. Good. Keep going until I say to stop. Okay. So I think you have good motion on your eyebrows. Good. Can I check your muscle volume on your face? Okay. So I'm just gonna ask you to put your eyebrows down. I'm just gonna hold down like this, and I'm gonna ask you to push it up. Okay. So holding them down, and now raise your eyebrows. Try raising them. Good. Okay. That seems okay. Do it again. Good. Okay. So eyebrows move normally, and now I'm gonna ask you to just your cheeks, just smile. Put your cheeks out like this wide. I'm just gonna feel here just to check your muscle. So smile. Good. Good. That looks good. Okay, perfect. Can you move your lips? Can you open your mouth? Wide, wide. Good job. So again, that looks symmetrical. I would say you're fully opening your mouth correctly. Can you stick your tongue out? Good. All the way. So that looks like it goes all the way. I'm just gonna look at your tongue and inspect it. Good. So can I do that? Can you do that again? Stick your tongue out. Good. Perfect. So your tongue looks completely normal. The color looks completely normal, and your throat looks free of any infections. Perfect. Okay. So symmetry is perfect. Facial expressions, normal. You were able to make all the facial expressions I asked. Okay, and then palpating your face, I didn't notice any muscle tone. So no muscle tone loss or difficulties moving any parts of your face. Okay. So, and again, inside your mouth looks completely normal. Perfect. And your tongue was a normal color. Perfect. And okay. Let me check now your facial sensations. Okay, so I'm just gonna touch touch different parts of your face, okay? But I want you to close your eyes. And whenever you feel me touch any part of your face, I want you to say now, okay? So just close your eyes. Perfect. So I'm just gonna touch. Now, good. Okay. Close your eyes. Perfect. Good. 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 Perfect. Very good. Okay. Yep. Excellent. Very good. Okay. So you're able to feel sensation everywhere. Now, where is my... One sec, I'm just gonna find my soft and hard objects. Okay, here they are. My soft and hard objects. So I'm just gonna touch your face either with the tip of my pencil like this. It won't draw on your skin, I promise. It'll just feel like a little hard object. And then I might touch it with this little furry brush, just like that. Just like this little brush, just barely touching your face, okay? But it'll feel like a little brush stroke. Or I might just tap with this, okay? So you just tell me when you feel it, okay? And tell me if it's the hard object or the soft object or the hard object, okay? Perfect. So just again, close your eyes. Good. Okay. Hard object. Okay, perfect. Hard object again. Good. Soft. Good job. Yep. Hard object. Yep. Soft object. Yep. Hard object. Yep. Soft object. Yep. Soft object. Yep. Hard object. Good. Okay. Hard object. Good. Yep. Soft object. You got it. Perfect. So I would say good on your forehead. Everything seems to be good with sensation there. Your cheeks, you got it. Your chin, you got it. Your nose, let me test your nose. Just close your eyes again. Good. Okay, yep. Yes, that was soft. Perfect, yep. Yep, so just on both sides of the nose. No problems there. Okay, so you got all of them. Good job. Everything seems normal in that case. Perfect. Okay. I'm gonna move on to your eyes, okay? So I'm gonna start off by inspecting your eyes. Have you noticed any difficulties with vision, any vision problems? Okay, any problems moving your eyes? Have you noticed anything? Okay. Do you have any previous eye conditions I should know about? Okay, and do you wear glasses? Okay, do you ever wear contacts? Okay, yeah. So contacts do tend to dry your eyes out a little bit, just why I'm asking in case I notice some dry eyes. Okay, and so again, I'm just looking at your eyelids and then looking at similarities between them, making sure there's no drooping maybe of one side of the eyelid versus the other. I don't see any of that. Okay, so that looks great. So I'm just gonna check with my light, okay, to see if there's any redness. Sometimes it's not always apparent until I look with the light. Okay, so I'm just gonna look at this eye first. Okay, on this side. Okay, so I'm just gonna come really close to you. Okay, let me just scoot over my chair. Perfect. Okay, so again, I'm just looking for any redness. Can you please look? Just follow my hand. Okay. Perfect. Just keep looking on this side right here. And now, again, just at this side, I'm looking at this eye only, okay? So this side, perfect. Perfect. And now look up here. Perfect. And now look down here. Okay. So I don't see any redness on that side. I'm just going to scroll over to this side. Okay. So again, just look where I tell you to look. So just first look straight at me. Look at my nose. Okay. Perfect. Okay, everything looks normal. So just follow my fingers, okay? Perfect. Now look up. Very good. Now look down. Perfect. And look here to the side. Perfect. Okay, so that looks fine. I'm actually going to get you to take your hand, this hand, yeah, just put it over this eye. Good. So this hand over this eye, just like this. Perfect. Then this side. Okay. There you go. So I'm just going to get you to follow my fingers, okay? Ready? Good. Perfect. 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 And then keep looking at it. Good. Just keep focused on my fingers, okay? Perfect. Okay. So that looks fine. I didn't notice any difficulties focusing on anything. Your pupils just followed the object well. So that looked fine. Okay, now I'm just going to get you to take this arm, good, this hand, and put it over this eye on this side, okay? Perfect. I'm just going to check the same thing, okay? Let's just follow my fingers. Good. Good. Follow them. Perfect. Okay. Perfect. Just the tip of my fingers, okay? Good. Perfect. Good. I'm just gonna follow them. I'm gonna take them out. Just keep focused on them. Perfect. I'm just gonna bring it in. Very close to you. Very close to you. Perfect. Keep focusing on them. Okay. Again, with this eye, I want you to follow my fingers. Okay, and all the way out. Good. And now follow it to the one side. Good. Now you're going to follow it to the other side. Good. Now follow it out. Good. Okay. Again, close. Perfect. So that looked fine. Okay. So that looks fine. I didn't notice anything. I think this eye you had a little bit more trouble focusing than on this eye. I assume you have maybe some astigmatism, yeah, but it's nothing big. Okay, so now I'm just going to test your vision. So I want you to take this hand and again close this eye. Okay, so you're going to tell me what number I'm holding up, okay? So I'm going to hold up like 2 here, and I just want you to say 2, okay? So again, cover it. Perfect. Good. Good. 1. Good. 4. Good. 3. Good. 2. Good. 5. Perfect. 3. Perfect. Okay, I'm gonna go a little bit further. Okay, I'm just gonna take my chair far away. Stay there. Stay covering. Perfect. 3. Yep. 2. Perfect. 5. Perfect. 2. Yep. 1. Okay. So your vision seems perfectly fine on that eye. Okay. So I'm just gonna get you to cover the other eye. Okay. So let go of that eye. Perfect. And just cover this side down. This side. Okay. Perfect. So I'm gonna test the same thing, and I'm gonna test your vision. Okay. So ready? Okay. 2. Perfect. Yep. 4. Perfect. Okay. Yep. 4. Good job. 5. Perfect. 1. Perfect. I'm just going to go further back just to check your vision, okay? So do that again. Good. Yep. Perfect. Yep, that was a thumbs up. And 4. Perfect. Okay, so great. Now let go. I'm just going to check now your visual field, okay? So now that I've determined that you're able to see all my fingers, I want you to cover, again, this side. I'm going to check the visual field of this side, okay? So I'm going to be checking this side, so cover this side. Perfect. So just cover it up with your hand. Good. Okay, ready? So I'm going to move it around your visual field, and now I just want you to tell me what number I'm holding up, okay? Good. Perfect. Perfect. Yep. 1. 5. 2. 3. 2. Perfect. So I'm going to do that again with this side. Now I'm going to take your hand and cover this side. Perfect. Okay. So what number am I holding up? Okay. Good. Perfect. 4. Good. 5. Perfect. 2. 1. Yep. 3. Perfect. Okay. So I'm going to cover now this side. Just want you to tell me when you see my fingers come into your vision. Okay. So I'm going to start further out. Yep. All right. Yep. Now, okay. Okay. Perfect. Okay. I'm just going to do the same thing. So I'm going to measure your peripheral vision. So covering this side. Perfect. Okay. Just say when, okay? Yep. Perfect. Okay. Good. 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 I'm going to do that again with both eyes open, okay? So just look straight at me, okay? Perfect. Here? Okay. Good. Perfect. Okay. So visual field seems fine. Now I'm just gonna get you to follow this light, okay? So, ready? I'm just gonna look at how your eyes track the light, okay? So just keep following the light. Perfect. Okay. Alright. Good. Keep following the light. You're looking right at the light. Good. Good. Okay. Okay, perfect. Okay. Now I'm just gonna get you to track my pencil, okay? So just look at the very tip. You see the tip of the pencil? Good. So I'm just gonna get you to follow it, okay? Okay, good. Just move both your eyes with the tip of the pencil. Good, you're looking there. Perfect. Okay. Okay, eyes seem to be moving normally. Good. Perfect. Good. And now just track my finger. Ready? Perfect. So I'm just looking at how your eyes move. They seem to be moving together normally. I don't see any major differences. I don't think that they've stopped tracking the object. Ready? So we're going to do this one now. Just follow the tip of my finger, just the very tip. Yep. Okay, good. Perfect. Good. Perfect. Okay. Okay, ready? Follow it now. Good. That one's good. Perfect. This side again. So the tip of this finger. Okay. So your eyes seem to be moving together. Okay. And they're able to track the object. So good news. Everything seems normal. Now I'm just going to check your pupillary response. Okay, so this part is a little uncomfortable because the light might be a little bright for some people, but I'm just going to cover your eyes and then shine the light in your face. Okay, and I just need to see, I'm sorry about it, I just need to see how your pupils dilate with response to the light and if they're dilating evenly. Okay, so I'm just going to keep both your eyes open to start off with. Okay. Alright, so cover them and good. Perfect. Ready? And good. Okay, so dilated. Perfect. Okay, evenly dilating pupils. Looks good. I'm going to do it from above. Perfect. I know it's bright. Perfect. Eyes dilating evenly. Okay, so now I'm just gonna only shine in it at one side of your face. Okay, but I'm looking at both eyes. So I'm checking if both eyes evenly dilate when only one side is illuminated. Okay. Alright, so I'm just gonna cover it so it doesn't go on the other eye. Okay. So okay, seems to be evenly dilating. Let me try from above. Alright, seems to be dilating. Perfect. Okay, so I'm just gonna again cover it, and now I'm gonna shine it on this side, and I'm checking if this side is dilating. Okay, and perfect. Alright, seems to be dilating. Perfect. From below. Perfect. This side again. Okay, well, that seems to be fine. Just make note of all that. Everything in your eyes seems completely normal. I didn't notice any asymmetries, any movement tracking problems, any vision problems, any blind spots. I didn't notice anything. Okay, so everything seems normal. Okay, perfect. I'm gonna look at your ears, okay? So I'm gonna have to stand up for this. But before that, I need to ask you, did you notice any issues with your hearing? Okay, so this one should be pretty simple. I'm just gonna make sure that you can hear me evenly on both sides. Do you feel like you can hear me better on one side? Okay, so I'm just gonna go and I'm gonna whisper something in both your ears. I'm gonna start off with this here, okay? So, applesauce. Can you repeat it back to me? Perfect. Alligator. Yep, that was the word. Tangerines. Perfect. Orange blossoms. Perfect. I'm going to do it a little bit softer now, okay? Just to see if you can really pick it up, okay? Leatherpurse. Orange backpack. Green apples. Perfect. So you got all of them. I'm going to go to this side. Just move my chair out of the way. So I'm just going to be whispering again onto this ear. And I'm going to start off with a louder whisper, and then I'm going to go down to a softer whisper, and I just want you to tell me what I said, okay? Perfect. Red lipstick. Perfect. Blue cat. Good. Italian vacation. Perfect. Okay, so I'm going to do a more softer whisper now, okay? Again, checking the same thing. Lavender fields. Yep, that was it. trees with fall leaves. Okay, and we're kind of playing a game of broken telephone at this point. Okay, I won't make it too long. Nectarines. Yep. Okay, perfect. Let me just get my flashlight. Okay, I'm just gonna look inside your ear. Okay, just to make sure. Okay, I don't see any buildup of wax, any redness. Everything looks fine. This ear. Okay, again, a fully clean airway. I do think you have a little bit of dryness in this ear. I would recommend looking into that, but nothing serious, really. Perfect. So, ears seem fine to me. Just make a note of that. Perfect. You got all those. The checklist, blind spot. Okay. Perfect. Okay. Now I'm going to check your taste. So have you noticed any taste issues in the past month? No? Okay, so you taste everything evenly. Any flavors that maybe have been suppressed? No, haven't noticed. Okay, perfect. So I'm just going to give you these little droplets, okay? They're just kind of like these tubes of droplets, and they're labeled, but I'm going to keep the label away from you so that you don't see what they are, okay? I'm just going to take a droplet. I'm going to put it on your tongue, okay? So I need you to stick out your tongue. I'm going to put a little droplet on your tongue, and I need you to just tell me what you taste, okay? Alright, perfect. So there are an assortment of different flavors, okay? I mean, it's common flavors, really, so you should be able to get it. If you can't get it, just guess, okay? Perfect, okay. So, stick up your tongue. Good. Chip, 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 chip. What would you say that was? Yep, that was cinnamon, yep. Good job. Okay, let me check what this one is. Okay, perfect. Ready? Perfect. Chirp, 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 chirp. Can you tell me what that was? Okay, I'll do it again. Ready? And chirp, 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 chirp. What was that? Yeah, that's exactly what it was. It was wasabi. I'm just testing your umami, okay? So, 2 more to go, okay? So, this one, let me just check what it is. Okay, ready? Okay. Drip, 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 drip. Okay, what was that? Yeah, it was apples. Yep, good job. Can you guess what kind of apple? No, that's like expert level. I don't expect you to know that. Okay, next one. This is the last one, okay? So stick your tongue out. Oh, yeah, I forgot to check. Okay, got it. Stick your tongue out. And drip, drip, drip. Okay, what was that? That was orange, yep. So that was citrus. We have citrus, sweet, salty, umami flavors, and you got them all right. So great job. Everything seems normal there. Taste. Sugar, umami flavored. Yep. We did citrus. Perfect. So finally, I'm just gonna check your sense of smell, and that's our last thing. Okay. So I'm gonna get you again to smell a bunch of different scents, and I'm just gonna waft them like this to you. Okay, I'm not gonna put them directly under your nose because some of these are really strong. Okay, and I don't want to put you through that. Okay. So again, I'm gonna keep the label from you so that you don't see what they are. Ready? Can you smell that? Perfect. So can you tell me what that smell was? Again? Okay. No, it's okay. I can do it however many times you want. Ready? Perfect. Okay, what did you smell? Yeah, that was cedarwood. Good job. Yep. It was very much cedarwood. I love that fragrance. Okay. So let me just see this one. Okay. Okay, ready? Waft it towards you. Okay, tell me what that is. Yep, that is orange. That is orange peel. Perfect. Okay, let's do this one. Let's do this one. Okay. This is a... I don't want to give it away, but you'll see. Yeah, that's rose. Yeah. That was an easy one. Hard to get rose wrong, you know? Okay, and then this is the last one, just for your sense of smell. Okay, so let's do that. Yeah, that is car tires. Good job. Yeah. So you got it. You got all of the scents and tastes right. So everything seems normal there. Normal scents. Okay, so I'm just gonna jot that down. That was the end of our assessment. So I didn't notice anything. I'm just gonna get that in your file. Okay. Perfect. So thank you so much for coming to this exam, and I didn't notice any difficulties or any problems with anything, so your cranial nerve should be fine. If you do notice any changes in the next month, no problem. Just call our secretary in the front and just book another appointment. I would gladly do another cranial nerve exam. You know, sometimes there's difficulties that don't pop up right away, but it's honestly unlikely. I'd say in your case, I haven't noticed anything that we should put a pin in, so everything should be fine. I think you're good to go. And I'm sorry about your car accident, but good news, it didn't really affect much, so that's really good. Just be sure to catch up with the secretary in case there's any further paperwork for you to sign. Also, make sure you change your address so that we have the proper address. And for your insurance information, you will have to speak to the secretary in the front, okay? And she should assist you with all of that. Just get this off. Good job. So thank you so much for coming, and have a good rest of your day. Okay, bye.